This session is called Students' Health and Safety Starts at Home and Continues on Campus, and we're all glad that you are here today. My name is Kelly Rawl, and I'm the Coordinator of Family Engagement, Community Outreach, and Teacher Support, and I'm very glad that you're here. Before we begin, let's take care of some housekeeping items. So we really want to be sure that everybody is in the right place. And so this whole session will be in English. And if you need the Arabic, French, or Spanish versions, then you need to click on one of these links. And that session is tomorrow at 4 o'clock, not today. So if you are not in the right place, then you would want to go ahead and leave this meeting. But we want everybody to stay who is able to understand. We also need to know that you're here. So please go to this link right here and fill out the little form. It's just a couple of questions to let us know who's here today. And then finally, if a question comes up while you're listening today, please type your question in the chat box. And then Fatina Jalambo, who is our district family engagement specialist, she will be monitoring the chat box and she'll let me know if there are any questions. Okay, any questions so far? All right. Oh, I forgot, I have to wait 10 seconds before so I give you time to answer. Okay.
Kelly? Yes,
ma'am.
I cannot, click on the link which you provided.
Oh. So you can write that down. It's HTTP. Oh, Fatina, would you put it in the chat box? Fatina, would you put the link for the attendance form in the chat box? So as we get started today, I just want all of y'all to know that HEB ISD takes the health and safety of our students and staff and communities very seriously. And they have done a very good job. The administration building has done a very good job of putting our protocols together in a way that will keep everyone safe and still allow us to work toward our goals, which is educating your students. So we're following the latest guidelines from the Infectious Disease Control at the state, local, and federal levels, and that includes the CDC, Texas Department of Health Services, and Tarrant County Public Health. We all have to take responsibility for our own health and that of our children and their safety, and we have to act in the manner that demonstrates respect and consideration for those around us. By following a few simple steps, we can protect ourselves, others, and our communities at school and at home. And we ask that all staff, students, and parents self-monitor for COVID-19 symptoms daily. The symptoms listed on this slide could be symptoms of COVID-19. And I say could be because some of those go along with seasonal allergies and something disagreeing with what you had for dinner last night. So we know that they could be symptoms of COVID-19. Remember, you don't have to have all of the symptoms, and some people do not have any symptoms at all and still are positive for COVID-19. If your child has one or more of these symptoms, you need to keep them home from school. If you do not have a working thermometer in your home, consider purchasing one. Check your own temperature and your child's temperature twice daily. If their temperature is 100 degrees Fahrenheit or 37.778 degrees Celsius or higher, then they must stay home. If your kiddos develop a fever at school, then your child will be required to remain out of school until they meet the return criteria. The rule of thumb is if your child does not feel well, then do not send them to school. The symptoms that you see listed here are severe symptoms. pain and pressure in the chest that does not go away, new confusion, that's different from I didn't get my coffee this morning, so I'm really confused. So if it's a new confusion, inability to wake up or stay awake, blue lips or face, or severe abdominal pains. If you have any of those, then you need to seek emergency medical care right away. Now, how do you know when it's okay for your child to go back to school? If they had a temperature and a sore throat and they were told they had to go home, there are 3 different ways that your child can qualify to go back to school. They have to have a clearance note from your medical provider to your school nurse, or they have to present a health clearance from Tarrant County Public Health to the school nurse, or you can notify your school nurse that your child has met the CDC criteria of being 10 days since the start of symptoms and 24 hours fever-free or fever less than 100.0 without the use of fever-reducing medicines like Tylenol or ibuprofen, and their symptoms have to have improved. Remember that any student, staff, or parent having any one or more of the COVID-19 symptoms that are not due to prior condition should stay home, isolate from other family members, and contact your medical provider. When a student or staff member reports a concern related to COVID-19, our HEB ISD health services professionals immediately begin to work to ensure the safety of everyone at our schools and buildings. Any person with symptoms or a positive test result for COVID-19 is immediately isolated from other people. All students will have their temperature taken daily prior to entering any school facility. Any student who has a temperature of 100 degrees or greater will immediately be asked to report to the school clinic. The nurse will wait 5 minutes and take a second temperature reading. If the student still maintains a temperature of 100 degrees or higher, the nurse will contact the parent or guardian to pick up the student. Students may return to school when they are cleared by a health professional, Tarrant County Public Health, or they meet the Centers for Disease Control symptom-based criteria, which we already talked about. But remember that that means that your child must have stayed home for 10 days since the start of symptoms. They're 24 hours without the use of fever-reducing medicines, and they're fever-free, and then their symptoms have been improved. Now, what happens when COVID-19 symptoms happen at school? Well, the campuses automatically start separating any student who shows COVID-19 symptoms while they're at school. And then they call the parent and have the parent or guardian come pick them up. District staff would then clean the areas used by the individual who shows the COVID-19 symptoms while they're at school. And that doesn't matter if it's a teacher or a student or some other staff member, but they clean those areas very quickly. And then students who report feeling feverish will be sent to the appropriate clinic for nurse assessment to determine if they're symptomatic. So as you can see, we're really working hard to make sure that we identify students with symptoms, and then we make sure that they get the care that they need. When it comes to transportation, we always encourage families to transport or walk their children to school. Some students will not be allowed to board a district school bus without a mask in place, covering both their nose and mouth. Failure to comply with the mask requirement will result in loss of bus privileges, and buses will be thoroughly cleaned twice a day. As of right now, all of our district facilities are closed to outside visitors except by appointment. So parents, you can schedule conferences with your teachers, and those can be either virtual or in person. Approved outside visitors and essential school volunteers will be required to wear a mask prior to entering a district facility. And campuses are not going to be able to hold their events like open house, carnivals, dances, school parties, or any other event that brings additional people onto the campus. We will be using outdoor spaces and playgrounds. As you know, being outdoors and spread apart reduces the likelihood that your students would be exposed or at risk of catching the virus. And when appropriate, our students will be outside during class. Examples of that would be like in PE. The safety instructions that we're providing are that all staff and students will practice personal safety measures, including these tips. First is hand washing. Second is coughing and sneezing etiquette, face masks, social distancing, food and drink, cleaning and sanitation. Enhanced hand hygiene. Always clean your hands when entering the building or after using the restroom, before and after eating and playing outside. So this is a short video that shows us how to properly wash our hands. So just kind of running cold water over it for 2 seconds isn't going to help very much. So let's take a look at this video. Oh no, I started it over. I'm sorry for that. In the rest of the video, you know, she's finishing washing her hands for 20 seconds, which is about how long it takes you to sing Happy Birthday twice. So after she rinses her hands, then she uses the towels to dry her hands and leave the restroom. Coughing and sneezing etiquette. So whenever you or your students have to cough or sneeze, then you should try to do it in your elbow so that you're preventing your cooties from going out in the air. They get stuck in your arm. If you can't do that, then get a tissue and sneeze into your tissue, and then throw it away and wash your hands when you're done, no matter what you do. Face masks are very, very important, where we all have to remember to wear our face coverings at all times when we're near other people. And since we're talking about face masks, remember that face masks really are only supposed to be worn one time. So if you can make or purchase additional face masks, then that's going to be very important so that your student can have a fresh, clean mask every time they go to school. I know wearing a face mask is kind of a bummer, but when I wear my face mask, then it shows that I respect and I'm considerate of you. And then when you wear yours, you're considerate and protecting the people in your family. So it just keeps adding up, and we're all just protecting each other more when we wear a face mask. remember that your face mask has to cover your nose and your mouth both. And we actually are training all of our students on the safety protocols at school. The last thing, or the number 4 on this slide, is social distancing. So classrooms will be arranged so that they can maintain that 6 feet apart for the students, and then they will be all facing the same direction. And in the cafeteria, there's going to be restricted use of the cafeteria during dining periods. That will require all campuses to use larger common areas as well as classrooms. Individually packaged meals will be served from a kiosk or the cafeteria serving line. Food and drink. It's very important not to share your food or drinks with any of your personal items. My granddaughter likes to take snacks to eat during the day, and she is sometimes somebody else has a better snack than she has, and she's tempted to share, but we tell her she can't do that. Until COVID-19 conditions dramatically improve, there will not be any large gatherings, or congregating in any area on the campus will not be allowed. Participation in extracurricular activities on campus must align with the University Interscholastic League, known as UIL, and non-UIL activity guidance. Links to these documents will be posted on the district website. Visual and performing arts and PE and athletics, they're following a plan that will help them maintain social distancing as much as possible. So I guess we all know what PPE stands for: personal protective equipment and personal hygiene. All students are going to be trained, or they are trained, on COVID-19 safety protocols. Each campus shall review health and hygiene practices with all the students, and this will include hand washing and the other safety tips that we just looked at. And each campus will have soap available in the restrooms, and students will have, and they'll have hand sanitizer in the classroom as well as gloves. Students will be required to sanitize their hands upon entry to the classroom, and each student and staff member will be issued a mask and a face shield. We didn't talk just a little while ago about cleaning and sanitation, but I want to go back to that because it's very important. HEB has developed a targeted cleaning process that specifically addresses COVID-19. And we were always careful to keep our classrooms neat and clean, but with everything going on in COVID-19, we're just being extra diligent. Each district facility will be cleaned daily with EPA approved products in accordance with the CDC guidelines. HEB ISD custodial employees have been trained on COVID-19 safety protocols. Cleaning and disinfecting will occur nightly in every classroom, common areas, and on high-touch surfaces. And the state recommends that each school district provide students the opportunity to clean their own space before and after they are used in ways that are safe and developmentally appropriate. HEB ISD will provide cleaning materials for students to sanitize their workspace, and restrooms, cafeterias, and computer labs will undergo extensive cleaning after each day's use. And now that we're back on track with the PPE information, just remember that any individual going into a school or district building or bus has to have a mask in place. Students in kindergarten and below will be allowed to wear face shields only because it's not developmentally appropriate for them to wear a mask. And for students in grades 1 through 12, all staff face shields may be worn in conjunction with masks, but are never a substitute for the mask unless the student or staff member has a documented medical exemption. While on district property, masks must be worn at all times, covering both the nose and the mouth, with the exception of lunch and other limited situations where the 6 feet distancing protocol can be maintained. Full face shields may be used in place of a mask to protect eyes, nose, and mouth when a mask is not feasible or whenever the educational objective requires the ability to see an individual's full face. Schools are required to comply with the Governor's Executive Order number GA-29, and that is regarding the wearing of face masks. Consideration may be given to age and developmental level of students as well as appropriateness for specific courses. So I just want to show you how far the state of Texas and HEB ISD specifically have gone to how serious they are at making all of our students and staff members be safe at school and work. HEB either has already received or will receive 210,192 disposable masks, 52,572 reusable masks, 86,572 gloves, 175 thermometers, 2,474 gallons of hand sanitizer, and 2,458 adult face shields. HEB ISD has purchased 40,000 additional face shields, 484 gallons of hand sanitizer, 100 thermometers, 12,900 disposable masks, and 35 backpack electronic sprayers. So I'm just sharing all those numbers with you because I want you to realize that HEB ISD has put their money where their mouth is, and we're doing everything possible to keep our students and staff members safe. We used several different resources from inside of HEB as well as the Centers for Disease Control and Prevention information to put together this program. These are additional HEB resources where you can go and find more information. I do want to point out that we are still asking parents and family members to apply for meal benefits. And to do that, you go to schoollunchapp.com. You can have paper applications also. You can get that from your child's school. And the reason we do that is very important. It helps us qualify for additional funding. And it doesn't even matter if you think you're going to qualify or not, or if you even think you're going to use it. We just ask you to go ahead and fill out the application. One other thing I want to remind you to do is to go online to complete your census for your household. If you've not already done that, you can go to 2020census.gov and fill out your census information. It really doesn't take very long at all, and it means so much when it comes to improving our communities and our schools. It has a far-reaching impact. So just remember that. And with that, I just want to thank you for joining us today. Tell us how we did by answering a few questions. Scan the code with your phone and complete the short survey. And Fatina, do we have any questions in the chat box? I'm not hearing any answer from Fatina. So let's see.
Oh, there you go.
Oh.
So yeah, she's asking.
I asked if you
I guess. Yeah, go ahead.
Did you have any questions in the chat box?
Yeah. So someone's asking. My daughter is in Coir, and she told me she needs a face shield. Will this be provided to her, or do I need to buy one for her? She starts school face-to-face in October 5th.
Mm-hmm.
Thank you.
A face mask should be provided for her. The school should have that for her. Was that the only question, Fatina?
Yes, that's the only question.
All right. Yes, she should get one of those as soon as she goes to school the first day. Okay. If there aren't any other questions, then I guess we're going to go ahead and sign off now. And
please remember to remind them to sign in. Everybody, the link is on the top.
Oh, in the chat box?
Yes, in the chat box. The
Good.
link at the top. If you can please sign in so we can just keep a data.
Mm-hmm. And the other thing is, if you have any questions, my email address is kellyrall@hebisd.edu. And my phone number is 817-399-2180.
I'm going to write it in the chat.
That's great. Thank you. If you have any questions, please feel free to look me up. Okay. All right. Thank you again. And I'm going to close the meeting.
So your number is 399-2108?
2180.
2180.
Yes.
Not the other way around. Okay.
Yes. All right. Thank
All
you.
right. Thanks.
Bye-bye.
Bye.
Thanks for attending, everyone.
Yes.
Bye-bye.